Regarding the Spanish influenza, if you get it, Dr. Robertson said, stay at home, rest in bed, keep warm, drink hot drinks, and stay quiet until the symptoms are past. Then continue to be careful, for the greatest danger is from pneumonia or some kindred disease after the influenza is gone. The American Medical Association in its journal has issued a statement upon Spanish influenza in which it says, according to current reports, a pandemic of an acute influenza-like disease is passing over Europe. Fortunately, the outbreak in England and among the Allied troops on the continent is now on the wane. The disease has been called Spanish influenza, presumably because it is believed to have started in Spain. The symptoms are described practically always in about the same terms: sudden onset with chills, severe headache, pains in the back and elsewhere, general malaise, flushed face, some soreness of the throat, and fever from 101 to 104, with a rather slow pulse. Usually crisis has occurred after 2 or 3 days, with rapid and complete recovery. In many cases there has been a harsh cough with a scanty sputum. Occasionally more severe bronchitis and even bronchopneumonia have developed. But among the young and healthy, there seem to have been no serious consequences and no definite statements that are made as to the death rate, which in any event thus far has been very low. The treatment remains symptomatic. Rest in bed, free movements of the bowels, and light diet are the most important measures. No doubt the spread of the infection, whatever it is, would be limited considerably if the dangers of droplet infection were recognized more widely and guarded against. Great Lake cases mild. 95 to 98% of the cases at Great Lakes are mild, Surgeon Owen J. Mink, Chief Medical Officer at the station, said last night. Recovery in most cases is a matter of 3 or 4 days. It is much like the influenza of the 90s, that would be the 1890s, which started in Siberia and swept around the world. Dr. Mink warns chiefly to be aware of after effects. He also advises, as a matter of caution, the family physician. The epidemic of Spanish influenza, which has given Army officials some concern, may have been started by German agents who were put ashore from a submarine. That was the last belief expressed today by Lieutenant Colonel Philip S. Doane, head of the Health and Sanitation Section of the Emergency Fleet Corporation. It is quite possible that the epidemic was started by Huns sent ashore by Bocce submarine commanders, he said. We know men have been ashore from such submarines. It would be quite easy for one of those German agents to turn loose Spanish influenza germs into a theater or other place where large number of persons are assembled. The Germans have started epidemics in Europe, and there is no reason why they should be particularly gentle to America. A program of prevention was started today in all the eastern shipyards. Post authorities at Boston are asked to examine all passengers of incoming ships. All shipyards on the East Coast and in the Great Lakes region have received instructions as to the methods of combating the disease. It's September 19th, 1918.